Seoul National University, both at pre-med and medical training. And today he will speak on controlling blood pressure and cholesterol.
한국말도 좀 하고 또 I'll speak English also, so all of us will be happy. And when you talk about the blood pressure and the cholesterol, now we are talking about cardiovascular disease that include heart attack, you call it 심장마비, myocardial infarction, or 협심증, angina, or you can have a stroke, 중풍, or mini stroke, TIA, or even peripheral vascular disease, those circulatory problem in your legs. So let's go to
keep going. And go again.
okay. The most important thing I have to emphasize to you is you need to see a good primary care physician. That is most important thing. If you want to take only one message today, that's the message you have to take home. One of our very close friend, she herself is a physician, is dying from terminal stage of stomach cancer in this country. The reason is the same as we all know. Well, I'm fine. I don't want to know. I don't have to see a doctor. I know what to do myself. Those kind of attitude will lead you, those kind of tragedy. Okay? If you see a primary care physician, they'll check your cholesterol, they'll check your blood pressure, they'll send you to the GI for those endoscopy. So you don't have to have those kind of disaster. The hypertension is defined as the systolic blood pressure of 130 and below. Some of them would say 120. There is a reason why 110, 120, 130, 140. Because when the pressure goes up, we'll see those slides later, then those complications of this blood pressure, that means cardiovascular disease, will go up together. So that's the reason why the cutoff point is usually 120, but 130 is okay. What about 140? Do I have to get treated? My blood pressure is 140 over 90. Not really, unless you have a diabetes, unless you have some so-called target organ damage. The blood pressure hits mostly your brain, your eyes, your heart, your kidney, or your peripheral vascular system. So blood pressure is divided into top number, bottom number. You all know that. And you can check your pressure at home. In doctor's office, usually our blood pressure goes up, whether you like it or not. So the doctor doesn't make a blood pressure hypertension diagnosis on the spot. Most of the times, we ask you to come back in a month or 2 months or 3 months. If you are heavy, well, why don't you lose some weight? If you smoke, stop smoking. If you drink a lot of caffeine, well, let's cut down some of that. If you're not doing any much exercise, let's do some exercise and then come back. Well, whenever I see a doctor, whenever I see a white gown, my pressure goes up. Then we can also do so-called ambulatory 24-hour blood pressure monitoring. You can do it in the hospital. Some office has that kind of device. So carry those blood pressure cuff for 24 hours. We measure the pressure and we scan those tape in the computer. And then we know how your blood pressure changes during the 24-hour period. So anyhow, the blood pressure affects about 50 million Americans, 70% are aware of their diagnosis. About 50% of those are treated, and 25%, only 25% are under control. So most of them, either they are aware of the diagnosis or they are not getting enough treatment. They somehow try not to take the medicine. Other question. Once I take this medicine, I have to take it all the time until my last day. So I don't want to take that. But that's a very unwise thinking. If you delay your treatment of the blood pressure, then your risk for cardiovascular disease, all those diseases I mentioned, the risk will go up higher and higher. So you're just trying to say, I don't want to know. And those so-called prehypertension, when your pressure is between 120 over 139 systolic and 80 over 89 diastolic, 50% of them will develop hypertension within 4 years. So you cannot just, well, my pressure is okay, so then I don't have to really pay attention to it. No, not really. You have to pay attention to it. You have to continuously follow with those primary care physicians. And so usually you can manage with the lifestyle modification, I mentioned about those. And if you do have other high-risk factors, then you have to get medication treatment. The lifestyle modifications. Number one is weight reductions. That will bring down your blood pressure 5 to 20. And healthy eating. That means a lot of fresh vegetables and fruits. And a low-fat diet. In Korean, more jakgukbap, more less amount of fat, more fish, those kind of things. And then our food are notoriously high in the sodium content. So that high sodium lead to the elevation of the blood pressure, okay? It does not cause hypertension all the time, but it helps to elevate your blood pressure. So if you don't add any salt in your food, that's going to be like a 4-gram sodium diet. When I was in the medical school, when the blood pressure patient comes into the hospital, the first thing they do is put them under bed rest and give them a hayan salba. And then maybe some hayan kimchi, that's all. And then after a couple of days, the blood pressure comes down. Of course, you cannot live on that, and you cannot stay in the hospital all the time. The physical activity, they recommend to walk 10,000 steps a day. 만보 걷기. 여러분 다 아시죠? 그래서 등허리에 땀이 좀 날 정도로. Until you get some sweat on your back, you have to do exercise. You can go out, walking, or jogging, dancing, bicycling, whatever you want to do. And moderation in the alcohol consumption.